I'm Dr. Courtney Tran at Cook Children's Pediatrics in Salina. A common question that I get during the newborn period is, does my baby have a tongue tie? I think a lot of parents ask me this question because either they've read up on it, or someone's mentioned tongue ties to them, or they've seen about it or heard about it from somewhere else, or maybe their baby is having difficulties with breastfeeding, so the question comes up. But I always like to back up and explain to them what normal anatomy looks like. Everyone has a lingual frenulum or a tongue frenulum, and the frenulum extends from the base of the tongue to the floor of the mouth, and we all have a tissue right there. This tissue, just like individuals vary, it varies as well. So sometimes it can be really thin, sometimes it can be very thick, and the insertion point at the base of the tongue also varies. So sometimes it's far back on the base of the tongue, and then sometimes it extends further towards the tip of the tongue. Based on how the anatomy is, sometimes that can cause some problems. Things that we look out for as a pediatrician is, does the baby have limited range of motion due to a possible tongue tie? So can they move their tongue from side to side? Can they touch the tongue to the roof of their mouth? Can they extrude the tongue past their lower lip? Another thing that I'll look for too is if the tongue kind of makes a heart shape, or it kind of clovers at the tip, or there's an indentation there, because that can mean a more significant tongue tie as well. So along with all of these factors, and then looking to see if the baby is having difficulties with breastfeeding, and difficulties with breastfeeding can mean trouble latching, or it could also mean that mom has nipple pain with latch as well. A pediatrician is going to be looking at all of these things to evaluate if your baby has a significant tongue tie. If your baby has a significant tongue tie or ankyloglossia, then the treatment course would be to clip the tongue tie. The medical term for this is a frenotomy or a frenulectomy. And usually that's performed by an ENT. But this is something, of course, you're going to want to discuss with your pediatrician before you jump to correction. And I always like to caution parents against jumping to an unnecessary procedure just because they see that their baby has a more significant frenulum, just because every procedure is with complication. So we don't want to do it unless it's completely necessary. So I would bring this up to your pediatrician if you have concerns that your baby has a tongue tie or ankyloglossia. For more information about tongue tie or ankyloglossia, please speak with your pediatrician, and you can also visit cookchildrens.org.